My name is Bill Fiebig. I was with IITA in the root and tuber program back in the 80s, and then FAO in the Seed and Plant Genetic Resource Service in the 90s. I was glad to hear that the second speaker talked about planting materials because it is not a seed. And then the lady from FAO or from the World Bank, she mentioned that she was talking about marketing and the differences between formal and informal distribution systems, because no private seed company is going to do something, market something that farmers can grow and save. I guess my biggest problem with the presentations here is talking about adoption. And I know Portuguese traders have talked for decades about orange sweet potatoes being around, but many Africans prefer the white flesh, but they can, in Mozambique, walk across the border in the tough seasons, in Malawi when the maize harvest is bad, and they can market their sweet potatoes there. And I guess I just would have liked to see more of a nutritional impact from the OSP program versus adoption of just growing it.
Thank you. Stephen Schomerger from the World Bank. Just a couple of quick questions. You may have mentioned it and I may have missed it, but what proportion of the farmers that we're talking about were women? And the second one was, in Dan's presentation, he mentioned that something like the vitamin, there was a strong, at least in Uganda, a strong vitamin A promotion campaign, and I'm not sure if that was the case in the other country. 65% of households already had a pretty good promotion or were already receiving vitamin A supplementation. So I'm wondering to what extent the fact that there were these pre-existing vitamin A promotion campaigns sort of really made the fact that there was an additional effort made under the project sort of not very important, but that might not be relevant in a country that hadn't benefited from some sort of intensive vitamin A promotion campaign already. Sort of going to Yuri's point that, is it really an unnecessary element to move this forward, or is it just that in these specific country contexts it was sort of repeating what was already happening?
Maybe you'll already cover this responding to Yuri, but I was just wondering a little bit more specifically what the market prices are like between orange and white flesh sweet potatoes, and like whether you can actually sell the orange sweet potatoes or whether people just don't want to buy them, which could explain the nutritional pathway that we don't see in some other crops.
So just two quick questions. One is I wonder how much you looked in both countries at how the cooking and feeding decisions are actually made in the households. So there's generally an assumption that it's the mother who's making those decisions, but there have been other studies that have found that interventions didn't work because they were targeted at mothers, and it turned out that mother-in-laws were the ones who actually made the buying decisions while they were still in the household. So, and you sort of alluded to the fact that fathers, the information was different than fathers, and maybe they're making more of the decision about what gets eaten than we're assuming. And then the second, I don't know, question or comment is, I almost wonder on the network side, even though you say it's the information network and not sort of the other networks, I mean, maybe there's less of a causal chain than we're thinking, and it really is just if enough people around me are still doing the same thing, and then I'm comfortable doing it, and I'm not going to change back again, and so. Maybe we're trying to read too much into it, but maybe not. And it's just a matter of that it's easier for me to keep, now that I've done it for 2 or 3 seasons and enough people around me are doing it, it seems like the thing to do. And so why rock the boat?
Are these on? Let me start answering questions because there are a lot now, and it'll help us keep our heads straight. So one question that's come up is, why are people adopting if it's not the nutritional messages. And actually what we think it is that the orange potatoes were agronomically superior. They were bred to be at least as good, if not better, than the white varieties that were available, or white or yellow varieties that are available. So the yields are going to be at least as good, if not higher. And combine that with the fact that consumers like them. In both countries, Harvest Plus conducted consumer acceptance studies in advance and sort of at the early stages of what we were doing, and consumers like them. And that's actually, I'm going to answer Dan's question too, because not only did consumers like them, but we see that in the price data. We did collect price data. They're very sparse actually, I think we did it in both countries, but I know the data in Mozambique better. They're very sparse, but they are always higher than white potatoes when both are available. It's true in Uganda. And it's true in Uganda as well. So we see revealed preference, we see price preference, we see all kinds of preference for the orange potatoes if they're available. Now, I'm trying to be very careful about what I say about the messaging, because I don't want to say you shouldn't do any nutritional messaging at all with orange sweet potatoes. What I'm saying is, going and teaching people, very narrow, detailed messages may not be necessary. Teaching people these are healthier than the white ones may be all you need to reduce vitamin A deficiency. And you don't have to go in and say, and teach people anything really beyond that. That's sort of what needs to go with an agricultural intervention. So if I was in your shoes in the bank in trying to get my agricultural colleagues on board with nutritional messaging in projects, that's the kind of messaging that you can, that might actually have big impacts, is what we're trying to say here. You don't have to come in with a full-blown behavior change project. You could go in with something much less than that, and it could still have the same types of nutritional impacts. I think that, so we have studied, another question was, why not study the nutrition? We have studied the nutrition. Those papers are published, and we're trying to go beyond that in this particular paper. And the focus on adoption is more that we haven't quite finished the analysis on the vitamin A side of things, but it's close.
Just to summarize, so there are really large effects on dietary intake of vitamin A among adult women, children aged 3 to 5, and children under age 3. So, and the under age 3 was really important because there was skepticism early on that it would reach them. Huge effects, huge increases in vitamin A intake for them, and because we did detailed dietary modules, we know what the sources of that increase was, and it was due to the orange sweet potato, and not primarily due to just learning, and then you go out and get a lot of papaya. It wasn't that.
Along those lines, we have also looked at other sources of vitamin A, and there are other sources of vitamin A that people become aware of through the project. We have direct impacts on we know the project has direct impacts on that. We don't see it as much through the dietary studies that Dan's talking about, but that could be, to some extent, seasonal availability. That's market prices. The gender of farmers. Most of the farmers in our sample, in all of the farm households in our sample, there was at least one wife present, because we were looking to hit mothers and children. That was a sampling. That was a rationale for our sampling.
In the Uganda sample, the farmer group members that received vines, 60% of them were women.
Yeah.
So some of the farmer groups are all women, and then others are co-ed. So on average, we ended up with more women than men. We're actually looking at that. We have some additional support to look at that. Roughly, it's a fairly complex story, actually, in households where both men and women make decisions about farming, but women take the lead over certain plots. You find orange sweet potato more commonly on those plots that they control. But
yeah, and we don't quite have comparable information in Mozambique, though. There was lower adoption, if I remember correctly, in female-headed households, though it's a small proportion of the sample.
Yeah, okay. So try not to miss. So the issue about child health days. So child health days twice a year have been going on in Uganda for a long time. I mean, they're fairly common in many places as a strategy particularly to get deworming out and vitamin A tablets as well. The kind of coverage of those of our sample was evenly spread because we had randomly selected communities. So there's no concern about that kind of confounding effects, except in the blood measures that we took. And there may have been some kind of pushing down our impact estimates on blood measures of vitamin A for Uganda, where we did try to look at effects on serum retinol. But yeah, it's true that we were essentially overlapping the Harvest Plus intervention with a standing supplementation program, but that's targeted only at children under 5. So this is a sort of household level intervention. It actually went into the diet, certainly of adult women, we think into all household members. So it's, and we couldn't only go to areas where they weren't doing supplementation because those areas are unique. So in terms of, Annette, you had asked about cooking and feeding decisions made within the households. We do know a bit about that. It is primarily, at least in Uganda, mothers that are driving that decision. I think it's the same in Mozambique. Early on in the project, that was one of the things we talked about. Should we be randomly giving nutrition trainings to women in some households and men in other households? I think some people were concerned that was just going to lead to too complex a story, so that we went right at the women. We took nutrition knowledge measures at baseline and endline for both men and women. The men didn't learn a lot, but they weren't targeted either. So, but apparently women don't tell their husbands a lot about that stuff.
Actually, we did ask the fathers where their main source of nutritional knowledge was, and it was emphatically, the modal answer was not their wives. So we can tell you, we can report that.
They talk
with
about
certainty.
other things. And so what if it's mimicry? That's a really important question, and it's one that we're now with the social networks paper. Scott and I are really trying to look at that much more and separate out. So we have these nutrition knowledge measures, and we're going to we're essentially going to do the same type of network analysis around people's knowledge of specific information, facts about vitamin A, about orange sweet potato, and see to what extent those facts actually seem to transmitted through the farmer group networks. So we can learn a little bit about that, and that would be important. I mean, I think this is an important story. If it turns out that people are really sharing specific information that's relevant to the crop about its agronomic characteristics, about its nutritional characteristics, that would be useful to know, because it has these implications for whether or not you spend a lot of time training on that or not. If it's mimicry, is that bad? No, that's great. But it probably does, it probably suggests a very different strategy, and one more like essentially a business model of getting a branding out there and trying to get large rates of adoption going, and then sustained through essentially people copying each other's behavior. Coca-Cola could teach us some things about that, I guess. But we are actually experimenting with that now. We're working with Harvest Plus in Uganda, looking at different rates. So we're actually going to randomly assign different rates of saturation of a community with orange sweet potato, and see whether or not the effects differ when you sort of give it to 50% of community members or half of that. There was also a question Yuri had about, okay, this is orange sweet potato. It makes sense that this works here. Will it be the same for beans or other maize or other crops? I think things could be quite different. But so Harvest Plus has research going on that. Alan and I are involved in some of it. Yeah. In Uganda, this scale up of orange sweet potato is being accompanied by a high iron bean variety. Alan's leading something in Rwanda looking at pricing of beans. So I expect things to be pretty different. So we'll see.
We can take a few more questions. We have a couple more minutes.
Yeah, Vanderbilt, and I work at USAID, so I look forward to working with both of you more. But I'm always interested in the use of impact evaluation results. Has Harvest Plus decided to do less of what was more expensive and less impactful? Or, is the government interested in this? Have you started disseminating and getting people to hopefully use what you've done? Thanks.
Yeah, Carla Zari, IFPRI. I was just confused, but maybe I missed the point. On composition of the treated and control between, because as I understand, Dan's paper is trying to study the spillover effect of between treated and control, right? And I was wondering, have your survey instrument been tested on the same treated and control or a different sample? Because it may be that the nutritional knowledge is also through, through you, researcher, that you go there to the house and say, oh, by the way, we are doing this exercise because maybe the interviewer, the respondent, has some interaction on vitamin A or sweet potatoes.
Wondering on your point, Alan. Oh, I'm Ben Wood from 3A. I was wondering on your point of the adoption of OFSP.
Sorry, we changed acronyms on you in the middle there. I dropped the F. I dropped the F.
You mentioned that there are a number of things you could ask them if they know that vitamin A, what contributes to vitamin A, and if they mentioned OFSP, then they are thought to understand. But what happens if they just mention like 20 things, right? And it happens to be OFSP. I mean, do you know if they actually know that it is one? Is it one of 3 or something they mentioned? Or
we can.
Yeah. Okay. Go ahead.
In terms of your question, Sophie, I think yes is the answer. It is being taken into account, both in the dissemination of OFSP and in the dissemination of other crops, conditional on knowing that other crops are not the same as OFSP. In terms of Ben's question, that's a really good one, and one I've thought about in a different way, which is that when you're asked to list something, you're going to have basically a cognitive limit. A good question is, please list all of the words you can think of that start with the letter B. And if I asked you to do that, you're going to come up with maybe 7 or 8 words, and you're going to hit a mental block. And psychological research shows this, actually. So, not only that, but the higher your innate intelligence is, the longer that list is going to be. So if we assume that because people haven't been to school as much, they've suffered from malnutrition as children, their cognitive limits are going to be hit a lot earlier in these situations than they would be otherwise. So the way I've actually thought about it is that we may have right-hand censoring in answering that kind of a question, because they're going to come up with a shorter list than somebody who, the people who've been through the training have really been through the training should know about 10 foods on our list. But nobody's going to be able to mention all 10 of those foods. Now, that said, I'm not too worried about the OFSP question being biased downward. So I've maybe changed the bias in your mind to being biased downward, because we've really hit them hard with messages about OFSP through this project. That's kind of an understatement. We haven't hit them nearly as hard with messages about carrots. So or mangoes, or papayas, or other things that are going to have, or liver. The other foods that are on our list that have vitamin A in them. So I'm going to be more likely to be underestimating those other impacts, I think. And I think it's, actually, I've asked some people. Jeff might still be here, to put that kind of open-ended questions into their survey forms, so we can study that type of a question in randomized impact evaluations, because I think there definitely is an underestimation here.
The analogy for OFSP would be if you spent 2 years talking to people about basketballs and then you ask them the B question. They're going to say basketball in one of the first few.
Right.
And that's what happened. I mean, with orange flesh sweet potato, we're not concerned that, people that know that should bring it up early, because the project was very intensive and they've had a lot of conversations about vitamin A and OFSP. Carlo, thanks for your question about, so to be clear, the social networks analysis that we're doing is not identified by the random assignment of the REU intervention across communities. So that's why we have to work really hard at trying to make sure that we've kind of swept out other effects, and make sure that it's not some sort of a bias driven by farmer group members being special. We think we've kind of thrown the book at that, and the results end up being pretty stable with the different types of approaches that we use. We've even tried some instrumental variables on that, and things don't change. But yeah, there are some effects so we're essentially, we have people that have been respondents to the survey that are treated farmer group members, that are control group farmer group members, and then that are neither of those, that are other people living in the same communities. We actually don't use the control group communities at all, although they also received the same surveys. We could, for example, look at whether or not some of the learning measures that we have as a kind of falsification test, we could see whether or not, look at the learning measures, because control groups didn't, within this course of the study, receive the vines. So they couldn't have adopted it. It was pretty much impossible for most of them to get it in Uganda. So, but they may have learned through radio, for example, something about orange sweet potato or vitamin A. So as a kind of falsification test we could look at learning that happened from treated farmer group members to their neighbors, and then look at whether or not similar learning happened between the control group and their neighbors, just to look at whether or not somehow our engagement with them drove things. I don't expect much from that. But we did find another interesting interview effect, which is that households, we became concerned that households that were in our sample that were not farmer group members were somehow, the adoption rates of 57% by them in the first season really surprised us. And so when we went back, we actually, we had already kind of were aware of this. So at the same time we were measuring that 57%, we drew an additional sample of non-member households that were not in the baseline and looked at their adoption rates. Adoption rates in baseline interviewed non-member households was 9 percentage points higher than other neighbors who weren't interviewed at the baseline. So apparently sitting with people for about 4 hours in 2007 on 2 separate surveys, one on nutrition and one on socioeconomics, that alone actually has about a 9 percentage point bump in adoption rates. So we can scrap the behavior change communication and just do a survey. Not really. But the size of the effect was really surprising to us. So we're working that into some of our work.
So on that note, thanks a lot for coming, and we look forward to seeing you November 15th.